Hi everyone, greetings from National Skills Network. This is Madhuri, and today I'm going to introduce you to a very new topic and a very crucial one for the society we live in today, which has got to do with a lot of caregiving, healthcare related professionals who need a lot of skilling, training, and also a lot of HR focus and to make it more organized in terms of services. So I'm very glad to have with me today Dr. Ratna Newar, who is the Director, HR and Admin and Quality at Premier Hospitals, Hyderabad. So welcome to this talk, Dr. Ratna.
Good afternoon, Madhuri.
Thank you. Thank you for giving us your time. And as we have been discussing, I think today it's the right time for us to take a few very crucial points in terms of training, skilling, upskilling. When it comes to a lot of job roles which are getting created, mostly newly, they are getting created tech-enabled or non-tech enabled. Because of lifestyle related diseases or a whole lot of stuff in our country, and helping many youth to build a career in this segment. And this segment, I'm calling it the allied healthcare sector. I think in which you have worked for a very long time. So you're the right person to bring the HR perspective and drive the importance of skilling and training. So let me get started by asking you about the scope for jobs, the scope for recruitment and careers in this sector. And what are some of the crucial job roles you feel are emerging? It's not just in Hyderabad we are talking about, it's all over the country. So can we have some pointers on this?
Yeah, sure. The thing is, if you have seen earlier, we would talk of healthcare as just, doctors, nurses, and the midwives. If you go to the remote areas, still there are midwives working over there, especially for the deliveries and all of the females. Or you would have some quacks who are working on it. But today, alternate medicine has got its place, and they are also getting a very prominent position, like the homeopathy doctors or the Ayurvedic doctors or the Unani doctors. They are also coming out quite fine. That is again still a medical sector. But today, because of the various complicated situations that human is going through, and I'm talking about globally, because if you see, as per McKinsey studies, recent studies, they are talking about something like, by 2030, rather by 2030, they are planning to show you that alone in Europe and America, there will be around 40 million jobs in the healthcare and allied healthcare, but you don't even have 9 million people to serve those positions. So what we see as a HR or a human resource person, that jobs are there, but there is no talent to match that vacancies. So what do you do then? That is one challenge. The second challenge projected by the same study was that 1 out of 4 in these two countries would be a person aged above 65. Now, when that is the situation, and we see so many complications, diabetes is at its peak, and because of diabetes, you have a lot of multi-organ failures these days. Geriatric systems have come to such a standstill. Our own homes have seen that most of the, especially India, most of the people are, having their children abroad. So there's no one at home to take care. Demands of life and lifestyle has become such that, even if they are at home, you have both the couple going out for work. So the geriatrics sector needs to look into. Dementia is at its high, and they are projecting that in the next 20 years, it's still going to be quite very high. So in such cases, the allied healthcare services is going to be a big help. You will need house helps. I mean, to begin with the lowest, house helps, to specialists like geriatric specialist, speech therapist, audiometrist, optometrist, physiotherapist, and there is at the same time sports side also has developed. Nowadays, you will see all the sports people are having trainers for themselves.
Yeah.
Athletes are having athlete trainers. So all this, there is a lot of job opportunity. At the same time, all these positions are also there. There are courses also. I was with DY Patil Medical College just before coming to Premier Hospital, and there we have a proper 3 years course for optometry. So so I think these medical colleges have started realizing and have started courses for them. So I think in the short while you will see lot of more such colleges will come up. Already we have seen government increasing medical health colleges itself.
Yeah. So I think this is like a huge talent requirement which is there, as we can
Yes.
see. Now, the moment we say talent, the next word would be, are they skilled enough? Are there skill gaps? Are they tech savvy enough? Because all medical procedures are undergoing a huge technology integration, as we can see, even if you take a small hospital. So keeping this in the backdrop, let's assume you pick up maybe 5 top job roles. It could be nursing. In nursing, you have the assistant nurse or the head nurse, or anything to do with that, or any other top 5 roles. Do you think that we have enough training going on? Because why I'm asking is, in these sectors, the training has to be recognized, accredited by very important organizations which come from the medical fraternity. Like, to give you an example, if somebody wants to give nursing as one of the vocational subjects in a graduation program like BVOC, I don't think it's easy for them to just do it. They'll have to get necessary certifications. Otherwise, the degree is not valid, right? And they should have a very good tie-up with a hospital or any healthcare. Or for that matter, even because you mentioned diabetes and others, even if it is anything to do with dialysis technician kind of a role, right? So all these are not very typical job roles which are in non-medical, non-healthcare sectors. So how do you see the picture unfolding here? Do we have enough training centers? Are people getting the right training? What are some of the hindrances we foresee here for this place to really pick up and accelerate?
See, ideally, I would give you one word answer ki we need to enhance training. Okay? Because this has just started developing. Allied healthcare side has started developing. What you're calling as dialysis technician, I would say the total paramedics. Whether it is emergency medical technicians, whether it is operation theater technicians, whether it is dialysis technicians, whether it is radiotherapists or
Yeah.
radiology technicians, or any of these things. All these courses have started, Madhuri. But I won't say that we have that many and institutions who have skills. So what I have come and done over here at Premier, or what I saw when I was at Apollo, is that we were doing tie-ups with these institutions and asking them that for their internship, because they also have their own limitations, these nursing colleges or paramedic institutions. So we do a MOU or a tie-up wherein we ask them to send their students to us, and then we train them in house along with our seniors, and then they get a internship done over here of 6 months or 3 months based on what their course is designed for.
Yeah.
And sometimes those students, if they have felt interested, they come back after their exams and they want to do another 6 months and get hands on, and we take them as trainees, and then we hire them also. So
Yeah.
that way there is a surety that they are actually getting hands on experience of what they have to practice. See, theory is one part of it,
Yeah.
but this, so I think most of the private hospitals should encourage this. That is the only one way right now that we can see that we have really great trained skilled people.
Yeah.
Otherwise it's little difficult unless we have these trainings in the institutions who are running these courses. And
Yeah.
I think we still
Yeah.
need quite some more institutions for it.
Yeah, correct. And also, I think you just mentioned a few examples, like you just mentioned about your own hospital. So probably it would be good to get little more into the details, like how does Premier Hospital, look into these issues? Because you are the HR person, you are the HR head. So you must be having a total, complete 360-degree kind of a view of getting skilled people or matching their skills with the requirements in your hospital. Because if they come with some generic skills, maybe your equipment, your procedures could be slightly different. That's one. And the second one is, what would be the kind of attrition you're facing? That also might give us an indication about how these trained people are staying back, or do they look for any career enhancement, or do they keep jumping from one job role to another, or one hospital to another? Can we get an idea from your hospital? How does it work?
See, I will tell you about my last 15 years. It's not
Okay.
only Premier Hospital, but it is even with all the other hospitals that I've worked. I've largely worked in this 15 to 18 years with 4 hospitals.
Okay.
Premier is the last one that where I am right now. So whether it was Apollo, whether it was DY Patil Medical College, Pune, or whether it is Hyderabad over here, I see one particular thing. Nurses, I think they do jump over, even if you give them best of the best opportunities, because they have a lot of commitments. They have their fee structure probably is so high that they are unable to get their last result until they have completed paying the fees in the college. So if they don't pay the fees in the college, they can't get registered with the Nursing Council of India. If they can't get their registration from the Nursing Council of India, that means they are not a registered nurse. So as per the quality accreditations, neither a JCI accredited hospital nor NABH accredited hospital would give them the right pay scale that they should get. So that is a drawback for them. So there should be some kind of help given to these people. I'm talking only about the nursing community. See, if I talk about the consultants and doctors and all, they come well educated, their skills are mapped out and matched, and without that you can't take the doctors, right? You can't take a doctor if he's not an MBBS. So those are already matched, and they also come with the registration only. But for nurses, even if they actually have passed with good marks, but because of this constraint of fees, which is what everybody gives me a story, that's why they can't get in a registration. Once they get in the registered thing, then the road is wide open for them. They even themselves don't want to stick over here in India. They try to write the exams and try to move off abroad. But I'll tell you, as in Premier, we Apollo, whichever way you take it, we call these people like a family. We treat them also like a family. We do some small things like, one consultant person comes with the family and spends some time with these nurses on a Sunday. That is just to do one kind of an employee engagement. From the skills perspective, we try to understand what their need is, and we map out along with the heads of the department to understand where they lack. So if there's a communication lack, we try to give them language skills training. If there is a skill lack, then we try to encourage them to come, and we even do tie-ups with the organizations from whom we buy these machines, like for dialysis and all, and we request their company people to get specialized trainers, and we conduct this training for them. Now, what happens when we conduct this training for them? It is for their benefit. One, because they are upgrading their skills. So when they upgrade their skills, definitely they get encouraged to have a good work-life balance, because that gets related to their incentives, to their promotions, to internal changes for them. Also, it gives them the benefit to get a recognition and reward. It gives them a benefit to strategize their workplace working life balances, and it's really good for their knowledge, because knowledge is power ultimately. So whether in-house or out, that is something we do. We train them and we try to retain them. We promote them. We try to discover having a chat with them. At least I do that. And I try to have a small chat with them when they come they come with their resignation, and then I'll ask them, is salary the part? They'll say, no, it's not like that, but this is what I want to do. So then we try to then organize some kind of trainings. Like, we compulsorily train everyone on a CPR. right from the ward boy, Aya to everyone, because it's a healthcare. And a patient coming in could just collapse in the OPD, where a nurse may be busy with some other patient. So if a IMA or someone is there, can at least give her some thrusts on the chest and try to take her to the nearest workstation. So there are specific trainings that we do. We give them whatever best we can. Not that I'm saying that the others don't do, they all must be doing, but we have to upskill. If you want to retain your staff, you have to do two, three things. You have to understand moments that matter to them. You can't just treat them as your employees. Those days are gone, where you could just treat an employee just as an employee. You have to treat them as one amongst one individual who could be having some different aspects, some different crisis, some different stress, lot of things. So we need to understand that.
Yeah. And also most of them are people who have migrated to cities, right? In these roles. That's another thing
Yes.
we see. So culturally also,
Culturally also there could be differences.
yeah, there could be disorientation and a lot of emotional issues. So I think that also
So we
takes.
even go down to a small thing like for our nurses
Yeah.
and some physiotherapists and some staff who use our hostel facilities. Like we give them a hostel facility because they don't stay in the same city.
Yeah.
So we give them at a nominal rate hostel facilities. We even design the food for them. Breakfast, we have a different menu every day. Lunch is a different menu every day. So at least, they get something of their taste.
Yeah.
There are some small things, but we do try to do.
But they matter a lot, I think.
Yeah, I think so, because that is what my attrition rate is, not even 2%. And those 2% mostly are either the nurses have got government jobs because suddenly they have opened up some government posts, or they are going abroad.
Yeah.
Or they are, taking resignation because they are planning a family. We have right from our consultant doctors who are with us for the last 35 years to our staff also who are with us for that long. So we are lucky, touch wood, in that concept.
Yeah, that's really nice to know in a world where, we see so much of moving on happening from in the same profession. So you already mentioned about upskilling, but I would like to ask you once again, for upskilling, for keeping them updated, as we say, to keep them relevant with the latest trends, technologies. Do you also invest in something like online learning or modules?
We
which
have a tie-up. We are tied up with Medlearn.
Yeah.
We are tied up with Dr. Reddy's. We are tied up with 3, 4 more organizations, like for the CPR and all with AHA. So we have professional institutions who come and do these trainings, and they give them the certificate. So those certificates are very important for them.
Yeah. There's another important point you already mentioned about their plans to go to countries where there is a lot of requirement. Let's say we'll take nursing itself as an example, but it can apply to other paramedics
Technicians
also.
also, yes.
Yeah, other paramedics also. Recently, we got to hear from someone who was helping us as, we had issues with my mother. I mean, personally also, we have gone through a
Sure,
phase
yes.
of dealing with a lot of these people. So one of them called us up and said that, she's planning to go to one of the countries, and then she was taking help of an agent and things like that. Everything sounded a bit worrying for us because she was not confident, and it would have meant a lot of cultural changes for her to go there as a nurse. And the reason why she wanted to go mainly was obviously the salary and things, and they want to earn more and come back. And she actually belongs to Jharkhand, so probably she would want to go back to Jharkhand. I'm just giving you one tiny example. There could be hundreds and thousands of such people who want to go to other countries. So how do you see this thing becoming more organized? Like if you look at the overall skilling system in India, we have this NSDC International, which is actually formalizing all these processes and making sure that there is no illegal migration, or these people don't get cheated, or they don't get misused, especially in the case of women. So all those things are actually happening, at the national level with important organizations like NSDC International. But how do we drive down these things to people who are there with with us, who perhaps must have worked with you or worked with us or anywhere. So along with this, what would be your advice, let me say, to people, young people who want to get into this career? Okay, they might also want to really go deeper into this and grow in this career, not just take it as something like a stopgap. And for those probably who want to go abroad and use their skills and knowledge. So for these two kind of young people, what would be your advice?
I think, counseling
Yeah.
is one thing which should happen, keep on happening whenever they are. I have some nurses who went abroad. We counseled them, we told them that, these days, touchwood salaries in India also, whether nursing, whether non-nursing, whether any skills,
Hmm.
not only hospital, anywhere, we are also paying up pretty fine.
Hmm.
So, unless they are really only looking at a great change, then that's a different thing. And I think there are examinations which they have to pass.
Yeah.
So, unless they clear those exams, like for the doctors, they have this USMLE to clear. So, for the
Hmm.
nurses, also, they have this IELTS to clear. So,
Hmm.
unless they clear those exams, they can't go abroad. So, that one concept I think is ruled out, that anybody can misuse them and go.
Hmm.
Now, rest all is a question mark. It's up to how they understand the work culture there, and what they have to go plan. What we do is, when we have such staff going from our end, we try to give them a little brief about that country. We try to make them see what all is needed. And we also assure them that if by chance things don't go fine for you over there, you're most welcome here. But
Hmm.
rest, I think, is a destiny. It's not only for nursing, any skill, any
Yeah,
skill people. It's a
that's true.
destiny.
Yeah.
Only counseling can help them. And if they go through the proper channel, if they are using agents and all, it's their personal decisions.
Right, that's true. And what about generally youth who want to get into this sector? Maybe a few words from you would be, helping
Which
them.
sector? Into
I said,
healthcare?
yeah, into
So
allied.
then they have to specialize. Like these days, you will see healthcare also has lot of things into it. Elite, as you have framed it. So what do they want to do?
Hmm.
If they want to become doctors, then that's a very prescribed decision. If they want to become a nurse, that's a very said old thing. Now there are some new opportunities like genetic counseling. First, genetics as a subject was there in many colleges, but now there is something called genetic counseling. For those kind of new developments that are coming up, there are some short courses which are there in the institutions, which are again under the guidelines of the Medical Council of India, where these people do these courses and come. So it's upon their interest.
Hmm.
Now, if somebody wants to be a physiotherapist or an audiometrist or
Yeah.
an ophthalmologist, they have to do these courses. You just can't pick up these courses. Even an emergency medicine technician
Hmm.
or a dialysis technician, these courses need to be done so that they are equipped with the knowledge. Then they need to, I would say, people want to immediately jump down to getting to do jobs. I preferably tell everyone, first 3 years of your career, you should not think about the money.
Hmm.
You should think about skilling yourself.
Yeah.
You should think about, the hunger should be there for knowledge.
Hmm.
That hunger, if it is there for knowledge, then they will learn. Then they can get multitasked, and then they can think of earning.
Hmm.
But today's youth wants fast money. They
Hmm.
want shortcuts. They want to grow overnight. They want a four-wheeler right on the first day of their job. Then they get into so many loans. Banking finances has become so easily accessible to people. So they get carried away because peer pressures,
Hmm.
house pressures. So they have to actually prioritize their needs in life. Unless you prioritize what you want, you really can't think of doing anything in life,
Yeah,
whichever sector you join.
that's
And
true.
healthcare is a sector where there is so much of chronic care management needed. So unless you are a person who can empathize with people, you should not choose healthcare. Healthcare needs people who have to be very patient, very patient. You can't be thinking that, you always have to feel that. Sometime back you said like your mom was sick, right?
Yeah.
So it is like that. You have to think, if my mother, my brother, my father, my sister, my granny, my child is sick, so that development and that interest, if that personality trait is there in the person, so they should do an introspection before choosing their career. And this, I think, should happen at plus, even before they go into plus 2. This should happen in every school. So ideally, they should have counselors in school. We had, I'm fortunate enough that way back when I finished in 80s my schooling, I had a psychological counsel in school. I studied from Kaval Convent, Pune, and we had a psychological counselor, Mrs. Swami, and she was extremely so good. Not only that she was beautiful to look at, but she had her ways to tell us what is important and what not. I think that foundation is needed at the school level, which is missing today.
Right. Yeah, so let's hope that these things will be integrated in the schools. Already with the National Education Policy 2020, there are few changes that are being recommended, and new courses are going to come into the school, which could be, one of them could be a vocational course. And I think this was really very valuable advice from you, as you said, not only for allied healthcare, but for any career for that matter. So thank you so much, Dr. Ratna Newar, for giving us your insights, and also telling us a very positive story of industry aligned skilling. So where we spoke about your hospital and how you're taking care of many things connected with talent acquisition, management, and upskilling, and so on. Thanks a lot. Thank you.
Thank you. Thank you.